Hey everyone, I am back and I want to talk through GTPAL systems. So what is this and why do I need to know it? This is a system we use to communicate a woman's pregnancy history. And yes, you will be tested on this in your OB. So it's really important to understand the terms that we're using and how it's structured. Now, I'm teaching you the way that it will be seen in a patient chart because I feel like that's critical, especially for your clinicals, but your questions will be a little bit more basic and we'll have it written out in a way that is very easy for you to understand and be able to break it down. So first and foremost, let's talk about the GTPAL and what it stands for. The G is gravida. That means how many pregnancies, including any abortions, as well as her current pregnancy. Many students forget to add the current pregnancy. T is the term. So that means 37 weeks or above counts for a term pregnancy. Preterm, that's going to be any pregnancies that are between 20 and the 36 and 6-7 weeks. That 6-7 weeks just means 6 out of 7 days for that 36 week. The A stands for any abortions, spontaneous or elective, and L is the number of living children associated with pregnancy. Please keep in mind that multiple gestation pregnancies will only count as one pregnancy in gravida, term, preterm, and abortion sections. But you're going to want to write out the number of children living. For example, if she was pregnant with twins in the L category, so that would be a 2. So let's go through one example here. On your patient's chart, her gravida and para is listed as G2P1002. So G2, how many times has she been pregnant? She has been pregnant twice, once before and her current pregnancy because she's here. She's a labor patient. How many term deliveries has she had? Well, that first number after the P is term. So that means she's had one pregnancy. How many preterm deliveries has she had? 0, because you can see the next number is a 0. How many abortions has she had? 0, because again, the next number is 0. How many living children does she have? 2. Wait a second, what does that mean? Well, that means with that first pregnancy, she had a multiple gestation pregnancy, aka twins. The next example I gave you breaks it down with how you will see it written out in a NCLEX styled question. So go through that, keep practicing, and please just keep following me for more tips, tricks, and resources. I hope that helps.